Heart to Hearts and the Untrained Ear by Ellie McLinden. In 2021, we are increasingly encouraged to present our most genuine selves, be vulnerable, embrace our weirdness, and communicate and share our thoughts and feelings with others. Many unique approaches have been used to tackle the declining mental health of the Australian population. From initiatives such as Are You OK Day, Brene Browning's teachings on how to be vulnerable, and social media podcasts such as The Imperfects, we are continually provoked to be fearless and engage in raw conversation. The concept of heart to hearts and the untrained ear can be defined as a complex conversation between two close individuals, highlighting their thoughts and feelings. Conversations may be triggered by, but are not limited to, individual trauma or hardship. The term untrained ear refers to an individual who is not trained in clinical psychological therapy. They may lack the appropriate skills to deal with the complexity and intensity of the conversation, which may impact them mentally. Empathy, rumination, and vicarious growth are three important factors that underpin the basis of heart-to-heart conversations. Empathetic engagement refers to the ability of an individual to figuratively place themselves in someone else's shoes, and furthermore, to experience the emotion that someone else is feeling. Qualitative research has identified that empathy is a significant contributor to vicarious growth in mental health professionals. There are two main aspects of rumination: intrusive and purposeful. Purposeful rumination is positively associated with post-traumatic growth in comparison with intrusive rumination, where literature has demonstrated that intrusive rumination establishes a negative form of cognitive processing. However, recent research has highlighted that purposeful rumination may only occur following intrusive rumination, and therefore highlights the importance it plays in a post-traumatic growth sequence. Vicarious post-traumatic growth is a theory characterised by positive psychological change that stems from listening and interacting with individuals who have directly experienced individual trauma. Growth is triggered by individual re-evaluation, and changes have been found to occur across 5 different domains. We are encouraged to have heart-to-heart conversations with family and friends. However, are we adequately equipped to engage in these interactions like psychologists are? Psychologists have access to debriefing and self-care resources that promote positive mental health and reduce the risk of burnout. There is a need to provide education and resources for individuals to establish clinical skills within the general population that will enable both parties to engage effectively with each other. Our research aims to consider the different perspectives of a confidant and discloser in heart-to-hearts, identify elements of the experience that were comforting and helpful to the confidant, and what positive or negative impact the conversation has on the confidant. The research question I'll be addressing is, how does empathetic engagement contribute to both intrusive and purposeful rumination in the confidant, and what effect does this have on vicarious post-traumatic growth? All variables will be measured utilising scales or questionnaires specific to their concept. Our study will aim to recruit 150 to 200 people. At a minimum, we need to recruit 107 participants to ensure adequate statistical power in data analysis. The recruitment process will be established utilising an online recruitment system called Cloud Research, which will be funded by our allocated student budget of $200. Data collection will commence in teaching period 1 in 2022. Data will be collected utilising an online questionnaire delivered via a Qualtrics platform. Participants will be required to complete screening, demographics, and contextual questionnaires prior to the commencement of the study. The study will contain the post-traumatic growth inventory to measure post-traumatic growth, the event-related rumination scale to measure rumination, and the empathetic experience scale to measure empathy. The study will take shape of a cross-sectional correlational design, and I'll be performing a multiple regression analysis with the use of 2 mediated variables. Results will be investigated using SPSS software. The implications of our study will enable us to inform everyday people on how to navigate heart-to-heart interactions. It will give us scope to develop informative toolkits that can be developed and made a part of important mental health campaigns that encourage individuals to engage in open conversations surrounding mental well-being, such as Are You OK Day? Ultimately, if we can improve mental health communication between a confider and a confidant, we will see an improvement in the overall mental well-being of the general population. There are a few ethical considerations that I'll need to make, including informed consent, which includes that participation must be voluntary, over the age of 18, that they are informed on the description of the purpose of the study, procedures involved, and what benefit it has to society, any foreseeable risks to the participant, and the subject's right to confidentiality and subject's right not to answer questions. Thank you.